Hello, hello. Happy Monday. My hair's a little wonky because I just went for a walk outside and it's super nice, but very windy. So today's Lunch and Learn is going to be on C-sections. Now, again, this is another one of those topics that I could talk for an hour and go into tons of detail, but for the purpose of this video, I just want it kind of short and concise and for you to start kind of putting things together for why you may have certain symptoms and to just learn more about C-sections. I did have a good question yesterday that just asked if today's topic was going to be on like making the decision to have a C-section versus like not side effects necessarily, but things that happen after having a C-section. It's definitely the latter. It's more kind of what happens during a C-section and then some of the aftermath of what I see patients for. The decision to have a C-section is solely between you and your medical provider. There is some research to kind of go into when it makes more sense than others, but again, every case is individual and that's something that you would want to discuss with your specific provider. So the first line item is just the anatomy of a C-section, right? So for some reason, we think of C-sections as this like minor little procedure that you can have as a way to get baby out and that wouldn't necessarily need rehab afterwards, like a lot of other surgeries that involve, going through tissue, which is so backwards, right? I mean, it is nothing for somebody to need months and months and months of rehab for other surgical intervention where they are, sewing things back together and like ACLs and rotator cuff surgery. So I don't know why there's this sort of stigma with the thought of having pelvic floor physical therapy after C-sections, but hopefully this kind of clears some of that up. So they actually go through 7 layers during a C-section, whether that is specifically cutting or what we call blunt dissection, where they either manually separate with fingers or use like some forceps or anything. But obviously I am not a surgeon, so I have never performed this. I've seen videos, I had it done to me, but they wouldn't let me watch, on my own. So I have it kind of written down in what order, and that is going to be important for the other 3 topics that we're going to talk about. So obviously first thing that they go through is your skin. And then they're going to cut through the fat that's underneath the surface of the skin, called your subcutaneous fat. And then they cut through what's called fascia. Now, fascia is this connective tissue that kind of helps to separate layers of tissue in the body. The best analogy I can use is if you have ever taken like a rotisserie chicken and like separated the muscle tissue apart, that sort of like spider webby stuff that separates like the breast from the other muscles, that's fascia, that's connective tissue, okay? Next, after the connective tissue is going to be muscles. So they don't cut through your muscles per se, like your abdominal muscles, but they do bluntly dissect between your abdominal muscles. Obviously, they have to go through those to get to baby. Now, them being gentle is, if it's not like a let's get baby out in 3 seconds kind of thing, then it's all hands on deck and they just cut through everything because it's the most important to get baby out. But this would be more along the lines of like a planned C-section, or when you've got some time and you can spare those extra couple of seconds to be gentle with the blunt dissection. Next, after the abdominal muscles, is the peritoneum. So the peritoneum is the kind of lining that separates the muscles from the organs, and they have different names for the peritoneum based off of where it's at in your body, but for the purposes of this, we're just going to call it the peritoneum. Then comes the uterus. So obviously that is a very thick muscle that has to get cut through, and then they have to cut open the amniotic sac. And then, you would be able to get baby out. But the reason, or because they cut through the uterus, that's part of why, depending on how closely together pregnancies are, you may or may not be a candidate for what's called a VBAC, or a vaginal birth after cesarean. And that's because if those pregnancies were close together, that scar tissue just hasn't really had a chance to form in order to withstand the forces of the contractions and the pushing during like a subsequent delivery. So that's one factor that goes into having a VBAC. But I do have a nice little picture. Let's see if you can see it. Ignore all my tabs. Let me turn the light off. There we go. So you can see skin, subcutaneous fat, and then we go into fascia, muscles, peritoneum, uterus, and then amniotic sac. But one thing that I do want you to look at, you can kind of see the yellow would be the fat here. And then we have the muscle that attaches onto the pubic bone. That's your abdominal muscles. But then this right here is your bladder. And you can see that there is this tissue that comes off of your bladder. That is the fascia. So that is the connective tissue that is right there. And so this is why scar tissue work is so important after C-sections. Any abdominal surgery, but specifically C-sections for this topic. And that is because, let's see, did it get too dark? There we go. So when you have interrupted this fascia right here, anytime that scar tissue isn't super mobile, it's going to create an abnormal pull at different sensations, and it's going to pull on your bladder. So that is why frequently when somebody's coming for urinary urgency, if they've had any sort of abdominal surgery, that is why we work on that scar, is because of that connection between that fascial system and the bladder. So the next little bullet just says that scar mobility is key with recovery. Right, so how are there different ways that you can work on your C-section scar? And that answer is absolutely. I'm going to turn the light back on. If you have just had the C-section, then what I typically recommend you start with is just that gentle belly breathing. That scar tissue is going to be much more receptive immediately in that postpartum and healing phase, so that as that scar tissue is laying down, it's going to be nice and mobile and be allowed to move like we need it to. If the C-section or the abdominal surgery was years and years and years before, we can absolutely still work on it, but it's going to take some more like hands-on techniques. So I can teach patients how to work on their scar, whether that's up and down, kind of going into circles. Depending on how sensitive the scar is, sometimes we just start away from the scar and work towards it. Sometimes you have to work on desensitizing the scar and just exposing it to different textures so that even light touch on the scar isn't just unnerving and an uncomfortable situation. So hands, the breathing, I can use dry needling on the scar tissue itself as a technique to release some of that tension, and then the myofascial cupping. I do have a reel that I've made previously, and so that's on Instagram, but I will share that to the Facebook page as well so that you can kind of see how that might be beneficial to making that scar tissue as mobile as possible. So yeah, you can see where if you go through all 7 of those layers, where there's going to be the potential for that scar to influence bladder urgency, abdominal pain, and then definitely even bowel motility as well, right? Especially, I see that more, I will say, with like the surgical procedures where they have like multiple portals, or if it's a vertical C-section incision, which depending on if it was an emergency or how long ago the C-section was. That vertical scar is just going to have more of an impact on your bowels than that low kind of bikini incision. So, moral of the story, if you have had a C-section or any major abdominal surgery and have urinary urgency, bowel issues, abdominal pain, pelvic floor therapy might be a good option for you so that we can just work on that scar tissue mobility and start to see what symptoms kind of diminish or even go away completely. Excuse me. So next week's Lunch and Learn is going to be on pooping body mechanics. So I will show you how to sit on the toilet to have a bowel movement to minimize your straining, kind of go behind the scenes a little bit as to why that is the case. And yeah, so I hope you guys have a great day and enjoy the beautiful weather over the next couple of days. Otherwise, I'll see you next Monday.